then we are likely waiting on Pennsylvania, Wisconsin, and Michigan.
By the way, I think it was the social media team's biggest victory today that they got George Stephanopoulos to do a TikTok video. They are all celebrating very hard right now. But Rick, in terms of the campaign, we are nearing the finish line now. It's the last-minute campaign push is on. So where are Trump and Biden heading this weekend, and what do they need to do in those key states?
They'll be all over the place, and it's so striking to see how the campaign comes full circle, because you'll see a lot out of those states that I mentioned, that blue wall, Pennsylvania, Wisconsin, Michigan. We know the Biden campaign is going to end with a lot of stumping those last 24, 36 hours in Pennsylvania, all the campaign folks and the surrogates. Tomorrow is a big day because Barack Obama and Joe Biden will reunite for the first time this campaign. They'll be trying to get out the vote in Michigan, and the president, man, I even lost track of how many rallies they have scheduled in states like North Carolina, and up through the upper Midwest, and a lot of Pennsylvania, a lot of Wisconsin, a lot of Michigan. It really comes back to those big three, with the president continuing to have to play defense in other places like Iowa. But I'll tell you, the stamina that it takes and the number of campaign events that this president will have done, these big, massive rallies in the age of COVID, stands without precedent.
All right, ABC News political director Rick Klein. Thanks, Rick. And be sure to tune in to our full coverage on Election Day starting at 7 a.m. Eastern. And George Stephanopoulos will anchor election night coverage with our political team at 7 p.m. Eastern. It all happens right here on ABC News Live. And you can find out how to vote in your state at 538.com.
Well, it's been a campaign unlike any other. The final countdown to the election is coming just as the country battles a new and alarming wave in coronavirus cases. All 13 of those battleground states we've been talking about are seeing an increase in confirmed cases today. ABC News' chief national correspondent, Matt Gutman, joins me now with more. Matt, I think you've got to be one of the leading reporters across the country on this pandemic. Hats off to you. You're back home in Los Angeles right now. Take us to the front lines. You've seen in hospitals in various places, I think recently Utah, Idaho, Montana, how they're dealing with this. What are you seeing on those front lines?
I'm really going to tell you a tale of three cities right now, Terry. First, with a lot of talk about Texas in this show, so we'll start there. El Paso, right? El Paso is basically seeing the worst of all worlds. That is the spot that not only has one of the highest COVID rates in the country, but also the highest number of hospitalizations. The city now pretty much on lockdown. There's a significant amount of political fight about how the lockdown should function. The county judge calling for it, the governor now trying to rescind the order. I won't get into that, but I'll give you a picture of what it looks like. Right now, a group named the SFFF, which is a major disaster relief organization, has built up those tents around the hospitals there. They alone have 800 staff members tending to the hospitals, building them up. They are flying patients out of El Paso, and right now we're just in the stage of hospitalizations. In a couple of weeks, we're going to see deaths, and a lot of them, unfortunately, in El Paso. I'll take you farther north. Salt Lake City, we were there 2 days ago, and there they are approaching capacity at the hospitals, right? COVID rate is soaring. They've doubled the numbers over the past month or so, and they're trying to deal with the influx there. They are on the precipice of something very, very bad because the main hospitals there, the Intermountain Healthcare Center, that basically takes care of people from Wyoming, Nevada, Utah, and Idaho as well. So they're about to get totally slammed. And then the place we were yesterday, Rexburg, Idaho, the #1 COVID hotspot in the entire country. It is a very small city with a very large college population, right? So it has the highest rate. Nobody, well, I wouldn't say nobody, but I'd say 50% of the people I saw wore a mask. I talked to college students. They said not once have they ever been asked to put a mask on going into any restaurant or supermarket. Most of their friends don't wear it. One young woman said, hey, I just had it. And her friend says, oh, that's interesting. They still weren't wearing masks. So that hospital is actually fine because the vast majority of people who've gotten sick there are young people, and if they have to be hospitalized, it's for a very short period of time. And so I actually went into the ER yesterday afternoon, and it was empty, not a single person there. So it really gives you a sense of the variety of what we're seeing across the country, and really that sense that some of these hospitals are empty because young people are getting sick serves to continue and prolong that vicious circle of people saying, well, this really can't be real. People aren't really getting sick, so why should I wear a mask? Why should I practice hygiene? Why should we socially distance? It's a very dangerous thing, Terry.
And Matt, that takes us to politics. We're a political show at this point, and I want to ask you, because you've got an excellent political mind, about that divide that you just described. President Trump is basically saying, let's get past it. We're almost past it anyway. We've got to get on with our lives. We can't let this thing dominate our imagination and our lives. Democrats are saying, we've got to save lives and buckle down, if not lock down. You're seeing that play out in real life. Have you got a sense that one side is more persuasive with Americans?
It's a really interesting question, right? I feel like the entire country right now is in this very large Scopes monkey trial, right? It's science versus all the other stuff. The fact is, these work, and I'll give you a personal anecdote, right? You and I both travel a lot. I have a cold every single month from February through the summer, right? For like 8-10 months, I have a cold. This year, I have not gotten sick once because I wear a mask pretty much everywhere I go. I practice hand hygiene. I socially distance. Coronavirus is a cold. It is a type of a virus that's very similar to the common cold, right? It is deadly, but people refuse to believe that these work, and they don't want their rights infringed upon. So in the redder states that we have gone to recently, parts of Texas, Idaho, Utah, Montana, South, North Dakota, that's where COVID is truly taking off right now because people are making a political stand out of wearing these. It should not be. It is sad to see, and the results are that we are likely seeing many more, tens of thousands of deaths, probably maybe 100,000 deaths than we should have seen at this point, Terry.
All right, Matt Gutman, back home in Los Angeles. Good to see you. Thanks for that.
Thanks, Matt. And the upper Midwest has been hit hard with COVID cases on the rise for weeks now in states like Wisconsin and Illinois. Now Ohio is following a similar trend. Yesterday, the state topped 3,000 new cases for the first time and then broke that record today, hitting a record high number of hospitalizations as well. The governor there said yesterday there is, quote, nowhere left to hide. So for more on this, let's bring in Dr. Harold Paz, the CEO of Ohio State University's Wexner Medical Center. Dr. Paz, thanks for being here.
Thank you for having me.
So I know sometimes it takes a little time before we see the impacts of these rising numbers. So what are things like there right now?
So in Columbus, at the Ohio State Wexner Medical Center, we're roughly at about 50% of where we were during the peak of the pandemic back in April. And that's great news. And we're also seeing less patients on mechanical ventilators and in the ICU. But the challenge is that we're the principal academic medical center for what's called Zone 2 in Ohio. That covers central Ohio and all of southeast Ohio, which is made up of 40 other hospitals across the region. And there we're seeing the highest total number of COVID-19 hospitalizations since the start of the pandemic. It surpasses the highest numbers we saw in the spring. And for the first time in this pandemic, this zone has the fewest number of ICU beds available across the region as well. And the reason for this is it's not in Columbus, it's in the rural parts of southeast and central Ohio that we're seeing the impact of COVID-19 on hospitalizations.
And in terms of the rise in cases and the way people are being affected in terms of hospitalizations, is this affecting rural, suburban, and urban areas differently, or do people in all of these areas need to be worried?
Well, we all have to be worried. We all have to practice the precautions necessary to stop the spread of the virus. But we're seeing parts of the state that were not impacted significantly back in the spring now, sadly, tragically catching up with what we saw in our urban areas back in the springtime. And that means we have to double down on the things that will prevent the spread of the virus. First and foremost, wearing a mask, frequent hand washing, creating a family bubble so that you're only with individuals that you know are COVID-free, avoiding large crowds. This virus can be stopped if we stop its spread. It goes away. And the way to stop the spread is by wearing a mask. It doesn't necessarily protect us, though there is some evidence that it does to a lesser degree. But what it does make sure is that we're not passing the virus on to somebody else.
And yesterday, Ohio Governor Mike DeWine called on each county to form a local COVID defense team. Some are calling that a dereliction of duty, saying that this requires a statewide response. What do you think? Would local defense teams help?
I think that each of us in our communities have to take a stand on stopping the spread of the virus. We've seen the benefit of that in Columbus, for example. We've seen it at our own medical center, where we've had incredibly low rates of our employees contracting the virus. These are first-line healthcare workers. There was a national study done with 13 major academic health centers around the nation. We had the lowest rates in that study. We've seen it on the campus of The Ohio State University. Our students, we have a relatively low rate of COVID infection on campus. But that's because as a university and as our medical center has spent enormous amounts of time on making sure there's mask wearing, social distancing, and if someone does become infected, because we're doing frequent testing, we do contact tracing and we make sure that those individuals quarantine and isolate.
All right, Dr. Harold Paz, good advice for everyone to follow. We appreciate your time today. Thank you.
Appreciate it. Thank you very much for having me.
It's our pleasure.
Thank you, Doctor. When we come back, just 4 days from Election Day, we're going to take a closer look at why one of the biggest political fights this year might be over your iPhone. Plus, we've seen so many great moments already from early voting, like this one where actor Paul Rudd handed out cookies to people waiting to vote in Brooklyn. More on that after the break.
Election of a lifetime, the most important vote, and with so much on the line, it demands the most straightforward news-making, real answers, the most informed voices from all sides. The countdown is on to the vote. What will our future look like? ABC's This Week with George. It all plays out right here every Sunday.
The most consequential week yet of this hyper-political year.
Right as you get closer to casting your vote every Sunday on ABC.
The reality is our country can collapse from within.
You see the white power movement on the march.
You will not replace us!
Klansmen and neo-Nazis, skinheads, it's meant to incite war.
From the KKK to Oklahoma City to Charlottesville, the new documentary event special.
We just need to start talking about race.
Homegrown hate, the war among us.
This is a real wake-up call.
Streaming now on ABC News Live.
COVID-19 was a wake-up call. Pandemic that could be just around the corner.